Hi guys, so I've never posted a YouTube video really, but I've been wanting to make a video about my surgery this summer. It was an orthognathic jaw surgery to correct an underbite. So I had the top jaw done, and basically I wanted to make this video sort of to talk about the preparation for the surgery, kind of how I knew I needed it, the actual procedure and recovery, and also talk about how I feel now. I'm about more than 6 months post-op. I had it in June 2015 and I'm making this video in February 2016, so it's been actually 8 months maybe now since I had the surgery. So I'm pretty much healed, and I wanted to wait a while before I decided to make this video. So the first thing I wanted to talk about was preparation for the surgery. Basically, when I was younger, my dentist referred me to an orthodontist. I was really young, probably like 8. And I started getting orthodontic work done to my teeth. As I grew, my lower jaw rotated forward, and my orthodontist noticed that I might need a procedure to correct that, so he recommended the surgery. He referred me to an oral surgeon, and the process went from there, so that's how I knew I needed to get the surgery. I had braces twice before surgery, once to straighten out my teeth, just to make them look presentable until I was ready to have the surgery, and then another time to actually ready the teeth for the surgery. So the second time having braces really wasn't about the straightening of the teeth, it was more about just getting the teeth in the right positions for the surgery. After I was all prepared to have the surgery, it was scheduled and everything, I made a couple visits to my oral surgeon for a consultation, just so he would see what he needed to do, and he decided that I just needed my top jaw to be moved forward. When you get an underbite correction surgery, sometimes they'll move your lower jaw and your upper jaw, sometimes they'll just move your upper jaw. It really depends on probably your surgeon and your bite, how severe it is. Mine was not as severe as others, so I only needed the top jaw to be moved forward. So I had the surgery scheduled, and it's performed at a hospital. You'll usually have to stay at least one night overnight. Basically, after the surgery was done, it's about a 2-hour procedure when you're only getting your top jaw done, probably a little longer if you get both jaws. So it was a 2-hour procedure, and what they do after surgery is they're going to rubber band your mouth shut. Some people are going to have more rubber bands than others. I only had a couple on the sides, one directly in the middle, but either way, your mouth is not, you can't open your mouth, so that's why the rubber bands are there, just to hold your mouth in place, keep your jaw tight, and yeah, so that's what the rubber bands are for. And since you can't open your mouth, you will have to drink liquids through something called a syringe. It's like a surgical syringe. It's not, it's a big plastic syringe type deal, and then they stick a tube on the end of it. And the tube, varying lengths, you can cut them. I had a couple different syringes, and they were different lengths. Basically, just, you know, whatever length you like the best. I don't think it really matters. You can just cut the tube. So basically for me, the first week after surgery was just a liquid diet. So in the hospital, they gave me the syringe, they taught me how to use it. I'd say the first week of recovery time was probably the worst. For me, it was hard because when they put you under, they're going to intubate you. So they're going to stick tubes in your nose. They ask you which nostril you want it in. For me, I really didn't care, but I think they did it in the right. So the right nostril for me was bloody for a while after the surgery, probably 3 or 4 days I would get bloody noses, and it would usually be in the in the nostril that they put the tube. And I think that somehow all of it's connected, and that causes congestion, which I had for quite a while, so I couldn't breathe out of my nose, couldn't breathe out of my mouth. So the first week was really miserable. And like I mentioned before, you're on a clear liquid diet for the first week, maybe even longer. Like I said, it just depends person to person. So for me, that was a lot of Gatorade, a lot of water. So you could have chicken broth, chicken soup, but I'm a really picky person, and I didn't have a lot of that. So for me, it was quite hard to get nutrients in. Like I said, Gatorade, water, nothing else really appealed to me since I couldn't have anything blended, no smoothies, no dairy, nothing like that. After the clear liquid diet is done, however, you can do smoothies and things like that, but you're still on another week or so a liquid diet, so it's still nothing that you can chew or anything. I think third week is when they introduced spoons again back into my diet, things I could spoon into my mouth, but nothing that I could chew. So by week 3 I was eating ice cream, I was putting things in my mouth and trying to mash them with my tongue, but still no chewing, nothing like that, week 3. And I had a lot of swelling. My face just swells up, I think, a lot more than is usual. I just swell a lot. The doctors at the hospital told me I was really swollen. When I got my wisdom teeth out, I was more swollen than a lot of other people. It really just depends on your face, but I swelled up a lot. So basically, probably I think by week 4, so after a month, they were telling me I could chew really soft foods. So for me, I did a lot of hash browns. I really like potatoes and stuff. I also did a lot of mashed potatoes week 3 when I could spoon things into my mouth. But yeah, I did hash browns, soft things. It's hard because after you get your jaw surgery, your teeth are in a completely different place than you're used to. So chewing for the first time was really weird. I felt like I had to teach myself how to eat again. Like when you smile, my teeth are overlapping and they never did, so I just felt kind of like my teeth were always in the way. I just wanted them back how they were for a while, just so I could chew and just so I could eat, because I wasn't used to eating with my new smile. As far as how I looked, it did take me a long time for my face to feel like it wasn't swollen anymore. My orthodontist and oral surgeon told me it could take up to 6 months for the swelling to go down. Here I am 8 months post-op and I really don't feel swollen at all, but for a while you do, even though it's just a little bit, maybe 80% of your swelling will go down in the first month, or no, maybe in the first 2 or 3 months, but still by month 4 and 5 and 6, I knew that my face was a little more swollen. And another thing is that you do sometimes, I think most of the time, lose feeling in your face. So now I have all the feeling back in my face for the most part, I think. Like if I push down here, it tingles a little bit still, even 8 months later. But all my feeling is back. For I think the first month though, I was basically numb at like all up here. My lips were very numb. I couldn't feel anything. Here was numb. Everything was pretty much tingling all the time. That's when, I think the tingling is when you're starting to get the feeling back, but it did take quite a long time for me to feel like everything was back to normal. And right now I feel like everything's fine. It's like I never had the surgery, of course, except for my teeth are in a different place than they were my entire life. So would I recommend the surgery to anyone? Yes, 100% I would recommend the surgery. My reasons for getting it, really I didn't feel like I had much of a choice, because for me it was really hard to chew on things, hard to breathe. I don't know how, like I mentioned before, I'm not sure how it's all connected, but my nose, nasal passageways opened up a lot more after I had the surgery. It's much easier for me to breathe through my nose than it ever was. I'm trying to think what other things. Of course, the smile. It is a cosmetic, there's a cosmetic aspect to the surgery, but it's definitely not the greatest thing about getting this done. Do I love the way that my smile looks now? Yeah, I do. I feel a lot more confident and a lot happier with the way that I look, with the way that my face looks. It's sort of like a subtle thing, I think. But when I see people, they tell me that they can tell I had the surgery, tell me my face looks great, and I'm really happy with the way it turned out. But like I mentioned, it's definitely not just a cosmetic thing. It was hard for me to breathe, hard for me to chew, and like just hard for me to do things that other people could do. Basically, my whole life, I can't really remember a time when my teeth overlapped because I was so young. So yeah, basically, if your orthodontist recommends this surgery to you, I would recommend that you definitely go forward with it. I feel 10 times better now that I've had it done. So I hope that this video was helpful for you. If you have any other questions, you can just post them in the comments and I'll try to answer the best that I can. At the end of this video now, I'm just going to show you guys some photos of me before the surgery and kind of just recovery, swelling, stuff like that, so you can kind of get a better idea of how everything looks.